After reaching her dramatic weight loss goals, our next guest wanted to treat herself to a little nip and tuck. But what she got instead was a botched procedure that left her in a world of pain.
I started gaining weight when I had my first child. Over the course of a 10-year period, I ballooned up to 267 pounds. I said enough is enough, and I just created a plan for myself. It was a little difficult at first, but I started seeing the weight coming off, and I just didn't stop. I kept going. I lost 142 pounds in 1 year. I had lost all this weight, and still I was not comfortable. There was a lot of loose skin on my thighs and the stomach area. I went to a surgeon, and he said I was a great candidate for getting the skin removed. When I came out of surgery, they told my husband that they kind of pulled it too tight, and the fat kind of protruded through the incision. The surgeon told me that you just take a little skin off your stomach and kind of cover it up to get it to heal faster. But it didn't go that way. I was only home for 2 days when I started feeling really sick. Both of my legs split open. My husband had just got back from Afghanistan, and he said he saw guys get blowed up, but he never seen anything look that bad because he could see my bones. When I got into the emergency room, I just remember one of the nurses saying, I can smell the infection. When they got the results back, they called my husband outside, and they told him that your wife has 5 infections growing in her leg. After 35 days, they finally got rid of the infections, and I was told that I now have a condition called lymphedema. Living with lymphedema is very debilitating. My legs feel so heavy, I could hardly walk. Always a lot of pain. You get tired very quickly. I'm just always afraid of falling. I want someone to help me feel better so I could put the pieces back together and try to enjoy life the best I can and live with it.
We sent Alicia to board-certified plastic surgeon and lymphedema expert Dr. Jay Granzo to see if there's anything he could do to help.
It sounds like you've had a tremendous problem with the legs. They're bigger. Obviously, the swelling has a tremendous negative impact on you, right?
Yes.
Now, is the size what bothers you most, or is it the amount of therapy, treatment, and all the other stuff that bothers you most?
It's everything about it.
It's everything about it, too. Okay. Let's take a peek and see what's going on. Okay, now, what I'm doing is I'm pushing down on your legs to get an idea of how much fluid is present in your legs right here. See how there's a bit of an indentation that stays. We'll see how long that indent stays. Now, the higher I get up your leg, it looks like I'm going to have less indentations. Okay, so here we have an indent, but it's not as deep. See how this one? It's harder to see, but I can still feel that my finger bumps down and goes down into that hole. This one's almost gone. Now, see your thighs here too. I won't be able to indent your legs actually further. Okay, right there like that. And you're noticing that fluid is accumulated in your legs on top of some of the solid stuff that's there. The fluid tends to accumulate lower down in your leg because of gravity. Does that make sense? All right, so with your legs, the swelling that you have and also the shape of your legs with the pitting that we talked about underneath is consistent with lymphedema on both sides. All right, now I'd like to get a test called a lymphoscintigraphy. That's a special test to look for lymphedema in your legs as a confirmation of that also. What that does is it shows us how bad that is, and it gives us a good idea of how well that whole lymph fluid is flowing in your legs. Okay. And otherwise, I'll put together a treatment plan, and we'll go over that next time we meet.